And now, luckily enough, Sian's on early, so we can move on to our next speaker. I'd like to introduce Sian Riley from Red Pepper Nutrition, and look forward to hearing you speak just now, Sian.
Thank you very much. Just sharing my screen here, so hopefully you can all see it and you can all hear. Okay. Thank you. I feel like then now that everyone's that Carl and Duncan have kept to time, there's a bit of pressure on me now. So thank you very much, Anne-Marie and Dig Brown, for inviting me to speak today. Just to say that I've got a few timed tweets coming out using the hashtag virtualHIID. So if you keep an eye on Twitter for those. So hello, my name's Sian Riley. That's me there, looking a little bit younger and a little bit fresher. I'm on LinkedIn if you want to link up with myself. I'm a registered dietitian, registered with the Healthcare Professions Council, which means we're accountable as healthcare professionals, which is really important. I'm the director and owner of Red Pepper Nutrition. We've now, over the last year, become a little small team, which is absolutely wonderful. A small team of dietitians and nutritionists who are specialised in traumatic injury and in particular brain injury. Please do check out the website for any more information. Myself, I tend to use Twitter quite a bit, so there's my Twitter handle, so please have a look today as well for some of those tweets that are coming out whilst I talk. One of my associate paediatric dietitians, Olivia, she takes care of the Instagram social media side for Red Pepper Nutrition as well. I kind of feel that, I don't know if I'm sharing my age, but yeah, it's just too much for me, Instagram. So what will I be talking about today? Talking about the importance of nutrition in acquired brain injury rehabilitation, the importance of nutrition in brain health in general. And I want to get across that food is complex. Hopefully we'll have time for some questions, but if we don't, please continue the conversation on Twitter. So I always start with this analogy of my body is a temple. So I'm sorry and not sorry at the same time for using this analogy again. I kind of feel it's a good one. So I like to use it. So yeah, my body is a temple. It's a busy temple. It's a busy building, and there's this constant need to repair and upkeep our building. For the repair and upkeep, we have these workers who work 24 hours a day, 7 days a week to repair our busy building when it needs doing. If there's damage to, say, a wall, a chip, knock in the wall, the workers go down to the storage rooms and get the necessary materials for the job. So if it's a knock in the wall, they will go and get some plaster and some paint and make that repair. You've probably guessed that the storage rooms are our nutrient storage rooms, and it's really important that these nutrient storage rooms are full so that this repair and upkeep can happen as effectively and as efficiently as possible. There are reasons why our storage rooms or our nutrient storage rooms aren't always full. It might be simply in the case of a growing teenager who's using up these nutrient storage rooms really quickly because they're growing so fast. It might also be something like a simple case of someone dieting. So when we're dieting, we are reducing our calorie intake, but we're also reducing our food and our nutrient intake as well. So after a traumatic injury, it's like an earthquake has hit our temple. The damage to our temple is absolutely immense, and our nutritional needs, So our workers get to work repairing the temple after the earthquake, but this means that our storage rooms, our nutrient storage rooms, are depleted really quickly because our nutritional needs go up so massively. So in this case, the hospital dietitians, the medics in the hospital will be working really hard to ensure that the storage rooms are replenished, but quite often it is quite difficult to keep those storage rooms as full as possible because the nutritional needs are so great. And for many of our clients after a traumatic brain injury, it's not just the earthquake that they have to endure. There's a number of aftershocks, such as things like picking up infections in hospital or having further surgery in hospital. We also have swallow issues linked to people after brain injury, and of course smell issues that we've talked about. And all these are aftershocks to our temple, to our busy building. So for many people, rehabilitation after a traumatic injury actually starts in a state of malnutrition. So this is a state where we're getting poor nutrition, we're not getting enough nutrients or getting more than we need. So our storage rooms are either overflowing or they're empty. And of course, we've got hundreds of these nutrient storage rooms. So some may be overflowing, some may be empty, and that's still being in a state of malnutrition. So why is nutrition important in rehabilitation? Well, I would argue that it's the foundation of rehabilitation. Nutrition is the building blocks of repair and healing. But it's also about prevention. We need to be preventing malnutrition. We need to be preventing these storage rooms getting empty, because many of the issues of malnutrition are then linked to other chronic diseases such as obesity or cardiovascular disease, and also mental health. So I'd like to ask you the question. I probably won't get an answer back because there's many of you on today, but can somebody be overweight and malnourished? And I would absolutely say yes, they can. Quite often somebody can be overweight and it blinds us to their lack of nutrition, or it blinds us to the fact that they're malnourished. And I see this as my job as a dietitian, to look past people's weight and look at the state of their storage rooms, if you like. So how do we recognise malnutrition? So there are some screening tools that we use. You might have heard of the MUST screening tool, which is often used in hospitals and care settings. And this is the Malnutrition Universal Screening Tool. And it's kind of, it's a screening tool that usually looks at somebody's weight and their weight history for whether they're at risk of malnutrition. And this does tell us part of the story, but in rehabilitation, I think we need to look at the bigger picture. So I feel that body composition tells us more. Quite often in the early stages, the acute stages after an injury, we lose a lot of muscle mass, and that's because the nutritional needs have gone up so high. If we don't meet these nutritional needs, our body starts breaking down muscle mass. And then further down the line, when we start eating more normally, quite often we can put on the weight back on as fat mass. So sometimes our weight doesn't reflect that change to our body composition. So for myself, I would measure someone's body composition using some fancy scales that I've got. But a really simple way of measuring somebody's fat mass, if you like, is to measure their waist circumference. We tend to store a lot of our fat around our middle, around our waist, and this is called visceral fat, which is actually really unhealthy for us because it's around our organs. Measuring your waist circumference is a really good way of seeing if you're losing fat mass or losing lean muscle mass. And one of my tweets that's sending out at the moment is about waist circumference. So it's a link to the NHS website, just giving you the measurements so you know what to look for. So when we're talking about fueling rehabilitation with food, we're also looking at somebody's bloods is really useful. It's a snapshot in time, but it's quite useful to see where the nutrient storage rooms are at the moment. So we're looking in particular for things like vitamin D, B vitamins, iron as well. We also want to look at someone's clinical history. What earthquake have they been through? Because that gives us a really good indication of whether they'll be whether we can recognise malnutrition in them. And of course, looking at the dietary intake, are they able to eat how they would want to eat? Are they enjoying their food? Have they had these other aftershocks of the smell? Loss issues that may be affecting their dietary intake, swallowing issues as well. So it's really important that we're fueling rehabilitation optimally. It's not just looking at somebody's weight. So I talked before about malnutrition. If we're not meeting these nutritional needs, we get the breakdown of protein, we get the breakdown of muscle, and we have a number of muscles. We have muscles in our arms and our legs, and when we have the breakdown of protein, we get the breakdown of these muscles in our arms and our legs, and that can lead to mobility issues, which I'm sure the physios listening will be very aware of, and it also leads to increased risk of falls as well. When we break down muscle, we also break down muscles in our heart. So obviously really important that we're keeping our heart as strong as possible, and we can lose some of the muscle mass from our heart, which isn't often so visible as well. Our immune system uses a huge amount of protein. So if we're not getting in enough protein, then we'll be breaking that down as well. And obviously we want to have our immune system as tip-top as possible. But also in terms of the vaccination programme, we need our immune system to be responding appropriately and efficiently to the vaccines as well. So swallow muscles, there's a really kind of complex array of swallow muscles involved in the swallowing process, which I know I've got some speech and language therapists on board. They could probably explain it much better than me. But it's incredibly complex. And when we lose muscle mass, we're also losing muscles from the swallow function as well. And this is a really vicious cycle, because a reduced swallow can often lead to increased risk of malnutrition and dehydration. It increases our risk of choking and aspiration, and it increases the risk of pneumonia as well. And all this is a vicious cycle leading to increased risk of malnutrition, increased loss of muscle mass. So how else does malnutrition affect our body? Well, there was a really interesting study done in 1945 called the Minnesota Keys Starvation Study. And this looked at 36 young fit men, and I've highlighted young fit there because these men haven't been through an earthquake like many people have who've had a head injury, that they're young fit. So these young fit men were put on a 6-month semi-starvation diet, and they had about 1,500 calories a day, which is half their requirements. Now, again, I've highlighted this 1,500 kilocalories a day because although this was half their requirements as calculated, you can see from that number that it is reasonable. And if you think if someone was telling you they were having 1,500 calories a day because they were, say, dieting, you wouldn't necessarily be concerned, but just hold that figure in your mind as half their requirements cause semi-starvation, and this caused a number of symptoms. So after 6 months of semi-starvation, physically they saw this muscle breakdown. So what we were talking about before, that they weren't getting enough calories in, therefore their muscles started breaking down, and they saw this as well. They had decreased heart and metabolic rate. So your metabolic rate is the your like internal factory, if you like. It's how many calories you're burning off each day. If you're not getting in enough fuel in, your body will start kind of switching off some of these processes so that it reduces the amount of energy you're burning off. It was also resulted in hair loss, headaches and fatigue. And again, I've highlighted fatigue because this is obviously something very common after a head injury. And quite often we put all the fatigue down to the head injury, but sometimes it can be down to not fueling yourself appropriately as well. So socially, these young fit men became withdrawn and food became the main topic of conversation. Interestingly, these 1945 men actually started reading cookery books, which is, you know, for men in the 1945s, that wasn't a usual activity. So quite interesting how they became quite obsessed with the subject of food. Cognitively, they lacked concentration, comprehension and alertness, and psychologically they became depressed, had anxiety, irritable, outbursts of anger, binge eating and food cravings. So it's really important that we're looking at the bigger picture when we're looking at people after a brain injury, that we're not just putting all these symptoms down to the brain injury, but that we're also looking at them as a whole as well. So it's really important that we're preventing these chronic diseases, that we're preventing malnutrition, because this will lead to other chronic conditions as well. So prevention is always better than cure. With malnutrition, it's kind of it's preventing that loss of this lean body mass. It's making sure their storage rooms that are optimally full. And this is preventing conditions then, chronic conditions such as obesity and cardiovascular disease. I'll talk a bit more about bowel conditions later on, and how important, if we're looking after our health, our gut is central to that. I don't have time to talk about mental health, but there's some really interesting areas emerging in terms of nutritional psychiatry. And again, I've got a link coming out on Twitter that links to a podcast that I did recently on nutritional psychiatry, if you want a bit more information on that. And we also need to be preventing neurodegeneration and looking after every single brain cell that we have. So I've also put there about questioning capacity. We need to question capacity for people after a brain injury. It's not good enough to kind of say they're adults, therefore they can make their own decisions. We need to be making sure that we're providing education, that we're giving people an informed choice about the food that they're eating, and that they can make informed decisions. There's a real inequality of education given to people with some research done in people with learning disabilities and what outcomes that produce. So we need to make sure that we're identifying these inequalities of education. So what does the brain need? This is a little neuron cell here, and our brain is made up of many of these millions of neuron cells. And they prioritize themselves. If your neurons die, they're taking you with it. So your brain does prioritize itself, thankfully. We need to keep it as healthy and happy as we can. So how does it prioritize itself? The brain needs oxygen. Needs oxygen for every single neuron to survive. So that means, from a nutritional point of view, we need to be making sure our respiratory and circulatory system is as strong as possible. We need to make sure our heart health is as strong as possible, that it's pumping that blood and the oxygen to our brain. We need to make sure our red blood cells are happy and healthy. So from a nutritional point of view, we'll be looking at things like iron, B vitamins, to make sure that those blood cells are doing their job effectively and efficiently. Our brain cells need glucose, sugar, for energy, and we need to make sure that glucose, that sugar, remains within a really tight range, and our body does this very effectively in normal situations. However, if we start developing conditions such as type 2 diabetes, our body loses the ability to regulate that, and then therefore it has to be done through dietary means or medication, or in some cases insulin. So we're getting this glucose directly from our diet, so we need to be aware of what we're eating. Our brain's got its own immune system, which is really protective. And once that immune system's turned on, it's really difficult to turn it off, because it's so protective. So when we talk about diet, we're looking at foods that are anti-inflammatory rather than inflammatory foods, to ensure that our immune system is responding appropriately to any damage or any threat to it. And of course, the function of our brain is communication. It needs stimulus, and it needs to be able to communicate. And it communicates through neurotransmitters, which are obviously often derived from our dietary nutrients that we're eating. So we've talked about the importance of our neurons, the importance of our brain, but just as important is our gut. And we quite often talk about the gut being our second brain. And the reason for this is that the brain in our gut is communicating with the brain in our head, and the brain in our head is communicating with the brain in our gut. When we talk about the brain in our gut, we're actually talking about the trillions of good and bad bacteria that are living in our gut, and how important this is to brain health and our overall health. So we know that we've talked about some of the nutrients that are absorbed from our gut, and these go to our brain. There's neurotransmitters that are absorbed. So the neurotransmitter serotonin, which is also a hormone, it's a feel-good hormone, and this is made by the good, or modulated by the good and bad bacteria in our gut, and this then sends the signals to our brain. There's also a factor called brain-derived neurotrophic factor, and this is a really important factor that basically signals cell death, so signals neuron death. So your neurons want this factor. If they've got it, they stay alive. If they don't have it, then that signals cell death. And our diet can modulate this level of this factor. So a healthy diet, exercise, and even socializing increases this factor. And things like a high sugar, high fat diet will actually decrease it. There's also something called short chain fatty acids, which are produced by the good bacteria in our gut. And these are actually food for our gut lining, so really important from a gut health point of view, but they also send signals to our brain and modulate the immune response there as well. And also the good bacteria in our gut help to modulate inflammation. So we talked about how important how to have an appropriate immune response is. So these good bacteria help that. I've just put at the bottom that diversity is really important. We want to get as much diversity in our gut bacteria as possible. So there's a little field here of wildflowers, and the more diverse wildflowers you get, the more chance the gut bacteria will respond appropriately to certain environmental conditions. And the way we get diversity in our good and bad bacteria is by getting in the good bacteria, so through things like probiotics or fermented food, naturally fermented food, but it's also by looking after them and feeding them with a good range and variety of foods and fibre in particular. So what other dietary issues are there after an acquired brain injury? Well, it's really complex, as we've discussed. it's not just about nutrition. We also need to look at the psychological side of food and the social side of food. We need to look holistically at someone. We need to be working in this centre bit and acknowledging all the different complexities of food. For many people after a brain injury, they might have a number of medications that they're on, and these can all affect the absorption of some nutrients, but also our appetite. It can reduce appetite or even increase appetite in some cases. After a brain injury, there's issues with independence. Somebody might have been the person who was providing the family meal, and this can sometimes be taken away from them and have huge consequences to their independence. We need to also look at mobility. After a brain injury, quite often there is a reduction in mobility, which can have an impact on somebody's eating, but also on somebody's perhaps weight as well. There are a number of mental health issues that need recognising after a brain injury, and very much so. I also feel there's a lot of body image issues after a traumatic injury. And this is quite understandable. Someone's body has changed in a relatively short amount of time, and there's a real grief there, and we need to be recognising this as an issue. And of course, smell loss, which we've talked about with Duncan and Carl. Smell loss is a huge issue after a brain injury. So I just wanted to very quickly talk about what we can do as dietitians, or when we're looking at food in terms of smell changes. The first thing is recognising and talking about it. There's a real loss of social interaction and a loss of familiar foods with smell changes, which Duncan and Carl have already very much talked about. But it's really important that we're recognising that. I know Duncan's talked in the past about this analogy, which I'm now going to nick. So Duncan describes flavour as a house, and that you've got these 5 basic tastes, and your basic tastes are like your foundation to your house, and your smell adds the walls to the house and the flavour. Obviously, in smell loss, we don't have the walls to our house, but we do have this foundation of the basic taste, and we can really use this to help our clients enjoy food that little bit more. So you probably remember from your school days this kind of taste map where different bits of your tongue a certain tastes. However, actually it's been found to not be true. So we've all been taught wrong, and these basic tastes are actually over the whole of your tongue. So the basic tastes are sweet, sour, sweet, salty, sour, bitter, and umami. So quite often after a brain injury, people will lean towards the basic tastes of sweet and salty, because it's important that we're feeling satisfied with our food and that we're getting some stimulation from it. And if we don't have the walls to our house, we only have these foundations. So quite often people after a head injury will lean towards the sweet and salty foods, and that can become a problem for heart health and obesity. So we just need to be aware of that, and that's why they're leaning towards them. The sour and the bitter basic tastes are there to kind of alert us for perhaps fruits that aren't ripe enough, or foods that can even be dangerous to us. But we can use these basic tastes. So things like lemon juice, lime juice can all be used in the cooking to stimulate those taste buds. And a really interesting one is umami, and Red Pepper Nutrition are hoping to produce little leaflets on umami in the coming weeks to give a bit more kind of detail on this. It's absolutely fascinating. Umami is the Japanese word for deliciousness, essence. It's this meaty, savoury flavour that you're getting, and it's making food feel really satisfying. It's also foods that are high in glutamate, which is an amino acid, which is a protein building block for protein. So you can see that it's almost our taste buds are driving us towards these more nutritious foods. We can also use trigeminal nerve stimulation. So we can, so this is almost a bit of a pain response, if you like, to hot foods. So things like chilies, spicy foods. Some people find it too much after smell loss, but some people find it's a real friend to them. We can also look at things like temperature, changing the temperature of the food so that we're getting that stimulation. And it's being mindful about what we're eating. It's using all your other senses. So it's using your eyes, it's using your hearing, it's using your touch with the textures to really kind of be absorbed in what we're eating. So I've talked a lot there about everything other than food, really. So if you're asking, well, what should I eat? What should I eat for tea tonight? The word diet means way of life, and we've seen diet as being a real negative, but it's a real positive. It's a way of life, and it's getting a really good variety, and it's about enjoying your food. It's about loving your food. The Mediterranean way of living is a fantastic diet to follow. It's full of whole grains, full of loads of fruits and vegetables, your oily fish, your lean meats. It's also probably a lot of sunshine as well, which we're lacking. And there's something called the DASH diet, which is the dietary approaches to stop hypertension. And that's looking at a similar kind of diet, but also about reducing salt and increasing your fruit and vegetables for their potassium content. And then there's a diet come out in the last few years called the MIND diet. And basically it's combined the Mediterranean and the DASH diet into this Mediterranean DASH intervention for neurodegenerative delay. And this, again, I've got a tweet coming out of this if you want a bit more information, but it's the whole grains, it's the oily fish, it's the olive oil, a little bit of red wine in there. It's the colourful fruits and veg, the green leafy veg, your berries are really important, nuts. So it's a fantastic diet to follow if you're asking the question, what can I eat? So just to summarise, nutrition is the foundation of health and rehabilitation. It's really simple. It's a varied, balanced diet, not always so simple to make it a way of life. But food is about independence, it's about empowerment, it's about quality of life, and we need to look at the social and psychological side as well. And it's just really important that we're prioritising nutrition because it is that foundation. So just to point you towards the Red Pepper Nutrition website if you want any more information. And there's also a recent podcast being released, which you might recognise some familiar voices in there. And just my contact details if you need them. Thank you very much.
Thank you so much, Sian. I don't know if I could have coped on that trial with that little calories, but I do have time for one quick question that I've just had from Maria. And I don't know if you can answer here or go back privately, but it's my husband had a traumatic brain injury. However, before this, he was treated for pancreatic cancer with Whipple surgery.
Right.
He's had to take pancreatic enzymes and follow a strict diet. Is there any further advice with regards to nutrition?
Yeah, I think that might need a one-to-one dietitian, really. That's a bit more complex than your usual. Maria, does he have a dietitian in either the NHS or privately? Yeah.
I think what I'll do is, if you don't mind, Sian, I'll follow this up with Maria and yourself after
That's fine.
today. That would be great. And thank you so much. It was really, really appreciated and really informative. And Twitter has went a little bit mad. So that's good. That's good. And you have kept on time. You are 3 minutes early.
Oh my goodness. Oh.
So thank you very much. And I'll just be moving on to our next speaker now.